treat breast cancer without surgery. So that is incredibly exciting for our women.
I don't want to sit around and think about whether or not there's another cancer growing in my breast.
I can't say it enough times. Go for your mammo.
Be comfortable with your care. Ask questions. Don't drive yourself crazy over statistics.
I listen to music prior to, during, and after surgery.
I never put that disease in the front seat with me. It always took a back seat.
What patients like Joanne are doing is they're pushing the needle forward to develop the better treatments for tomorrow.
This is our 21st year working with the American Cancer Society, and this year we feature their research on reducing the inevitable resistance to cancer drugs. I'm Sade Bedarin-Wong. In the next half hour, we also bring you new research that holds the promise of reducing repeated surgeries, plus the option of using lasers instead of surgery and what might work as an insurance against future recurrence. A new study at New York-Presbyterian examines whether laser ablation is a viable way for women with small breast cancers to avoid surgery completely.
My cancer was found with a mammogram. The diagnosis was precancerous.
Virginia did some research and heard about a clinical trial that she might qualify for.
This is Virginia's mammogram. She presented to us with a small mass that was detected on a screening mammogram. For this particular study, we are selecting women with very small, early-stage breast cancer. So cancers that are up to 2 centimeters in size in the breast, and it has to be in an ideal position in the breast, not too close to the skin, not too close to the chest wall, so that we can treat this safely and effectively.
They made me aware that I would have to have a lumpectomy after the laser treatment. So I agreed to do that.
We would then treat them using laser under ultrasound guidance. They are followed with additional imaging, such as MRI, to see how effective the treatment has been. We've enrolled 61 patients. Patients were very excited about this.
I hope that the laser treatment gets approved, because that would be terrific for women. It was like going into a dentist office, no problems whatsoever.
Being part of research to make things better was a great motivator.
Approximately 50% of women with breast cancer will qualify for this procedure. I think that really the main appeal is that now it's not only desirable, but possible to treat cancer without surgery. Surgery may be associated with pain, with scarring, with much anxiety. This new treatment, so far what we've seen is that there is less bleeding. It's much more convenient for the patient.
I'm 70 years old. I hadn't been for a mammogram in 2 years. The one important thing that I would say for women to have regular scheduled mammograms, because if they had not caught my breast cancer in the beginning when it was very small, they might not have been able to perform the laser surgery.